Welcome to week 13, public health and policy. We will also be talking about healthcare culture, system, trends, costs. So there will be a socio-political, financial, anthropological, cultural component to our examination. It's a very, very broad area. So let's begin with the first slide, and we will leave some room for questions toward the end of these lectures.
So let's begin with part one, healthcare system, cultures, and costs. Now, quick thing, we will not focus on specific costs in this slideshow. We will present an overall description, the links, current healthcare system and related models to cost-benefit analysis, but for the most current cost within the healthcare system, I refer you to the references as part of this module, this lecture. So let's begin with a general outline here. So we'll focus on basic definitions, different perspectives on health and healthcare, what we mean by health systems, how all these pieces fit together, dimensions of functioning, syndromes of dysfunction, and syndromic management, okay, management of problems and issues. All right, so the first slide here, it's a philosophical slide just because we love philosophy so much here. So health, right versus purchase. What do we mean by right? Is health and healthcare a human right? So two comparisons here. The Alma Ata Declaration of 1973 and a quote from Leonard Peikoff from the Ayn Rand Institute. The first one, health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, is a fundamental human right and a most important worldwide social goal. Okay, so healthcare and health as a right, a fundamental human right. The second one, quite a different attitude. No man, and by man of course here we mean human being, has a right to medical care. If he cannot pay for what he needs, well, then he must depend on voluntary charity. Now, full disclosure, I will agree with the first one and not with the second one, but I want to bring this to your attention because at the center of this idea, we find a lot of socio-political turmoil. Okay? We're talking about healthcare, and so I just want to make sure that healthcare systems are not structured based on simply providing medical care, for instance, to people, but that are predicted upon very specific overall cultural frameworks, okay? And I'm not expecting you to agree with one or the other, but I just want to point out how important it is to understand the theory, the philosophy, the culture, the history behind healthcare systems, right? Now, some distinctions, health versus healthcare. Overall, at least from a medical standpoint and health refers to a state of the human body and mind, okay? With the mind, we already talked about that this was an added term in the West, at least in the biomedical model, at least a state that we perceive as human beings. Healthcare instead refers to chemical devices and services used by people to improve their health or the health of their patients. Right? Insurance is a system of paying for unpredictable needs for healthcare. We already talked about that before in the first couple of weeks, especially by comparing the system we can find in the European Union as opposed to the system we find in the United States. But let's continue with some basic definition within healthcare economics. Economics units, groups of individuals brought together for a common purpose. Economic agent is an individual with a specific role in the system, for instance, a patient, a nurse, or a manager. Institutions, norms, rules of conduct, established procedures, for instance, property, corporations, paying fines, and tipping waiters. Definitions of systems, okay? Again, keep in mind the roots of the term, right? Sys, together, right? So, economic systems. A collection of economic units, agents, and institutions that interact coherently, adapting and adjusting to the social and physical environment. Now, this adapting and adjusting has some commonality with what we said in week 11 about developmental aspects, human growth and development. So think about Jean Piaget, for instance, within developmental psychology. Expect definition of coherence, adaptation, and adjustments. Health system, economic systems that are concerned with human health specifically. Okay, of course, we can talk about veterinary medicine as well, but health system in general refer mostly to human subjects. Although even that in turn can be based on animal models, especially within. Now, 7 common health systems. First, primary health service delivery system. Second, health workforce. Third, leadership and governance to ensure quality. Fourth, health system financing. Fifth, supplying medical products and technologies. Sixth, health system information. And 7, households. So those are all health systems. Okay, we sometimes associate health system with federal health systems or hospital-based health system or state-based health system, but those are all health systems. We talk about plurals, okay, not health system as a unique one factor type of system. Now, instruments from the perspective of public health and public policy, what instruments do these institutions have? We have direct controls, regulation, prohibitions, and compulsions. Think about cannabinoids, for instance. Think about vaccinations, okay? Indirect controls, tariffs and taxes, subsidies and grants. Think about medical research. In this context, we can look at the government as a consumer as well as the government as a producer. Government interventions. The government provides health insurance, provides healthcare, maintains health environment, and informs people about healthy lifestyles. Okay, think about single-payer models, Medicaid, Medicare, and think about a CDC, for instance, when informing sustains. The government funds health research and health worker training. Finally, the government and government institutions maintain standards, licenses health workers, approves drugs and devices, and finally approves hospital constructions and administrative patterns within specific architectural and urbanistic component within the construction. Now, when we talk about healthcare and we talk about system, we talk about policies. So health policies mixes multiple objectives. This is very broad, and of course, this is an introductory course in healthcare. A lot of these things might be further discussed if you're interested in this or that area within healthcare, but in general, those are main objectives. So objectives about health insurance, protection against the unpredictability of healthcare expenses. Objectives about healthcare, delivers only cost-worthy, which means efficient from a financial standpoint, healthcare. Equity and fairness in access to healthcare, making health services more respectful, kind, friendly, nurturing, patient-centered, etc., etc. Objectives about health, a special concern for the health of disadvantaged groups. Think about vulnerable population. Think about elderlies and children, for instance, as well as healthcare within the prison system, for instance, or minorities. Think about mental health issues, etc. A special concern for the health of workers, human capital, financing public goods that affect health. The last one is social objectives, accessibility of care, redistribution of income between rich and poor, healthy and sick, and powerful and weak. Wonderful. So dimension to assess. We will study these 7 dimensions across the many institutions that make up the 7 major health systems. In the second part, which is exactly the focus of this, we will focus on the comparison between local, state, which is within this dimension. So output, stability, fairness, efficiency, protection, freedom, and innovation. Okay, so those are 7 main dimensions that we will assess. Now, keep those terms in mind, and let's move on to part 2 of this lecture to see what we mean by that. Part 2 is public health. very broad topic, so we will focus on the most important things that I would like students to remember. And also, one thing I want to share here is that a lot of this information is taken either from the United States Department of Health or the CDC, and when applicable, you find the resources. So, from this perspective, what is health? We talk about the connection between terms such as healthy, healing, hailing, holy, whole, wholesome, etc. From the perspective of healthcare, health is a dynamic state of complete physical, mental, spiritual, and social well being, and not merely the absence of disease or infirmity. Thus, public health is what we as a society do collectively to assure the conditions in which people can be healthy. All right? So, this is just a general premise. Now, if we talk about in practice what we mean by lack of health, let's think about the top 10 causes of death in the United States, all right? As you can see here, heart disease and cancer play, unfortunately, the big role here, the biggest role in the top 10 cases of death. However, if you combine the remaining cause of death, you can see that a lot of preventive mechanisms you can utilize, right? So we have things such as specific diseases such as Alzheimer's, we have accidents, we have influenza, we have kidney disease, we have psychological issues behind intentional self-harm, for instance, we have diabetes. So preventive healthcare is an essential part of our intervention. Some elements that focus on this are public health policies and practices that have been implemented in the course of policies. Those are just a few examples: vaccinations, safer workplace, safer and healthier food, motor vehicle safety, control of infectious diseases, decline in death from coronary heart disease and stroke, and of course here we mentioned the connection between psychology and medicine. We mentioned this multiple times. Think about type A versus type B. Family planning, recognition of tobacco use as health hazard, healthier mothers and babies, and fluoridation of drinking water. Those are just a few examples in this context. All right, so let's move on to these three elements, assurance, assessment, and policy development here. You can see this wheel, okay, similar to the wheel of health that we seen previously. You have research at the center and system management in each of these areas. All right, so you have monitor health, diagnose, and investigate within the assessment portion. You have inform, educate, empower, mobilize community partnership, and develop policies within policy development. And finally, you have enforce laws linked to provide care, assure common workforce, and evaluate within assurance. Now, as you can see here, those are all interconnected. So from evaluate to monitor health, between assurance assessment, from diagnose and investigate to inform, educate, empower in policy development, and finally develop policies and enforce laws between policy development and assurance. So this is a good model to understand system management from the perspective of public health. Now, when we think about each element or each institution, as we previously mentioned, let's start with federal public health. And again, we can make a lot of comparisons here, but the main focus of this lecture will be the United States. So federal public health roles and responsibilities, part one. Ensure all levels of government have the capabilities to provide essential public health services, act when health threats may span more than one state, a region, or the entire nation, act where the solution may be beyond the jurisdiction of individual states, act to assist the states where they lack the expertise or the resources to effectively respond in a public health emergency. Examples here: disaster, bioterrorism, or an emerging disease or a pandemic, for instance. Facilitate the formulation of public health goals in collaboration with state and local governments and other relevant stakeholders. Continue. Federal government plays a crucial role in providing leadership through regulatory powers in setting health goals, policies, and standards, in operational and financial resources, financing research and higher education, supporting development of scientific and technological tools need to improve the effectiveness of public health infrastructures at all levels. So this is just a general overview for the federal public health perspective. We focus now on the local health department, see how each of these pieces fit together. Local decentralized. Local health departments are units led by local governments which make most fiscal decisions. This is a very important aspect from the perspective of management and cost benefit analysis. You have mixed. Some local health departments are led by state government and some are led by local government. No one arrangement predominates in the state. This is kind of the mix. Then you have state centralized. All local health departments are units of state government, which makes most fiscal decisions. And finally, you have shared. All local health departments are governed by both state and local authorities. Now let's take a look at the diagram and the map in the next slide. All right. So local health departments governs type by state. Okay. Now we are here in Vermont, so you can see here everything in Vermont is state, similar to what you can find as well in Arizona, etc. And in red you have shared, Kentucky, for instance, and Florida, right, Georgia. And the rest it's a mix between local. All LHDs are in the state or units of local government, and mixed LHD in state have more than one governance type. Okay, so this is just to give you a general overview of how the structure is subdivided in terms of local health department by each state in the mainland. Now, in this slide, in this pie chart, instead, we see the percentage of total annual local health departments revenues by revenue source. So as you can see here, you have the two biggest one, local 26% and state direct 21%, immediately followed by federal pass-through 14% and Medicaid 13%. The rest is subdivided into other 6%, fees 7%, Medicare 3%, federal direct 6%, PHER 2%, ARRA 1%. Okay? Let's continue with our examination. Local health departments, part 4. This is the percentage of local health departments providing the 10 most frequent activities and services available through local health departments directly. The first one, 92%, adult immunization provision. The second one, the third one with the same percentage, communicable infectious disease surveillance and child immunization provision. Extremely important in these times we live in. Tuberculosis screening, food service establishment inspection, environmental health surveillance, food safety education, tuberculosis treatment, schools daycare center inspection, and finally, top 10, population-based nutrition services. So you can see each of these areas focuses on what we've been discussing throughout the semester, right? You have infection control, you have immunization, you have nutrition elements, you have specific pathologies and pandemic elements, you have public health and environmental health, you have lifespan developmental components, child immunization, etc., etc. In the next slide, instead, you see the main functions performed by local health departments: review regulations, recommend public health policies, recommend community public health priorities, recommend health departments priorities, propose public health regulations, collaborate with health departments strategic plan, collaborate with health departments to establish priorities, ensure that community health assessment is completed, revise public health regulation, and finally, again, this top 10, establish community public health priorities. Wonderful. So let's continue. A few more diagram and slide here. Last theoretical discussion this week, more numbers, all right? Part 6, recommend health department budget approval. Approve health department budgets, identify source of funding, receive fees, and approve grant applications in the top 5. And the next slide, we see state health agency funding by source, okay? The biggest one, federal fund, 45%. Followed by state general funds, 23%, other state funds, 60%, and then in order, fees and fines, 7%, other sources, 5%, and Medicare, Medicaid, 4%. All right, of course, we talk a lot about mainland United States, but I feel that we should also focus, at least for a slide, on public health in American Indian and Alaska Native tribes. Now, in this context, I will not analyze the proper use of the term American Indian, Native, or First People, etc., etc. But those are the terminology usually utilized at the federal level by the CDC and Department of Health. Tribal Health Department is a corporation or organization operated under the jurisdiction of a federally recognized tribe or association of federally recognized tribes, and is funded by the tribe or tribes and or contract service or services from the Indian Health Service or IHS. Tribal health organizations include tribal health departments, Indian Health Service units, area Indian health boards, and urban Indian health centers, a much broader groups and relates to a variety of entities that might provide health services in a tribal setting. This, of course, goes back to our discussion of folk medicine, traditional ethnomedicine, medical anthropology, and so on and so forth. So I will encourage you to revisit those concepts to better understand this type of healthcare structures. Wonderful. Moving on to the next slide, we will see other types of parallel to the government, state, or federal organization, and or NGOs, okay, so non-governmental. So at the center, of course, you have the public health agency, which we previously examined, but then you have a lot of other elements, right? You have civic groups, you have neighborhood organizations, schools, you have nursing homes, you have law enforcement, employers, you have hospitals, home health, laboratories, community centers, etc., etc. So it's really important to understand that healthcare systems are, by definition, a net of microsystems here, deeply interconnected and intertwined. Okay? Now, in fact, we could argue that the main scope of medicine is to treat the individual, okay, based on current science, informed, evidence-based, patient-centered care, while healthcare main goal is to serve the population, the community, society as a whole. So that's a big distinction. The individual, single subject, as opposed to the community, group of subject, group of people. Wonderful. Second part of parallel NGOs. Again, at the center, you have the federal, state, or local component and tribal health component, but then everything else plays a role in the way the healthcare system works. But then I mean the way we receive healthcare services and also the way we are informed about healthcare services, medical research, how we get funding, research perspectives, and so on and so forth. So you have, of course, philanthropy and private donors. You have media that plays a role, especially in popular science. You have churches, synagogues, temples, and other religious institutions, mosques, etc. You have schools, you have community services, mental health services, etc., etc. So it's a very broad pictures, right? Wonderful. Now, if you are interested in any of this area, particularly for the perspective of complete your final paper, I really encourage you to continue the research and make sure you have the most current data about each of these areas. Wonderful. So let's move on to the next topic.
Now let's talk about the requirements for the final project and paper for this course. So if you could go to the very last section in your syllabus document, let's analyze this part together. Students are expected to write a paper on the chosen healthcare area. The content of the paper needs to address and or be related to one area or subject discussed in class. For instance, as an example, students can choose from multiple clinical medical techniques, strategies, traditions, and methods and analyze or compare them. They can focus on clinical, medical, anthropological, historical, philosophical factors, or the combination of the above, relate to the chosen healthcare area, or focus on one or multiple authors, scientists, and practitioners. An important element here is that students can also include personal experiences, individual or group session-based, with healthcare. For every statement or claim, students are expected to provide a scientific reference in the form of a peer-reviewed research, meta-analysis, or studies journal articles or scholarly sources, preferably randomized case control studies or similarly valid study on the hierarchy of evidence. We will be talking about that in week number 1. The suggested amount of reference and bibliography is 5 to 7, with sources published in the last 7 years, unless one or more of such references contains a theoretical or historical examination of the healthcare area presented. Added materials such as statistical analysis, graphs, images, links to slideshows or websites are accepted, but they're not required. For the final exam, the final paper, please write a 10 pages, at least, essay on the healthcare project, the same topic the students have chosen for the draft. Students, again, can also include PowerPoint, slideshow, or other video, multimedia elements to help the presentation, but all these are not required. And this is, again, due on class 14, soft deadline, and definitely by class 15 for the completion of the course. Format. All work submitted for the final project must be submitted handwritten or typed. You have an option. Please follow standard notes for written assignments if the document is typed. I have included some example here, the Chicago Mellon style, the Harvard Reference Styles Guide, or APA or AMA, and there are a few clickable links here that can guide you through that process if you're not familiar with that type of writing. Structure. Your assignments must have all clear introduction, body, and conclusion. They must also have addressed the key components being asked for in the assignments, and outlines must have clear organization. Mechanics and clarity. All work must use correct grammar and spelling. It may also flow well and be easy to understand and read. For citations, similar to what we said earlier about the Harvard, the Chicago, or APA or AMA, if a reference is used in your project, it must be cited properly. For more information on using citation, you can also click on the website provided by your college, whose link is included in the documents. Of course, needless to say, all work submitted must represent the student's original thinking and voice. Of course, students can use other sources, but any citation used with proper reference will be considered plagiarized. So this is a very, very important thing to remember here. There is a general guideline in terms of, and a rubric in terms of the expectation for the final project. Please review this document. And again, if you have any questions, feel free to email me anytime. Wonderful. So this was the very last slide, the very last topic for this lecture, week 13. Thank you all. We are approaching the end of the semester, so please email me if there's any questions regarding the final project. Otherwise, I will see you all in week 14. Bye-bye.